back to Dissecting the Past, episode 33. Oh, Behind the Knife. I'm going to be your host today, Rachel Dunn. Joining with us today is Abraham Sachs, and he's going to be our historian. Abraham, would you like to introduce yourself?
Yes, I'm Abraham Sachs. I'm a history enthusiast, especially when it comes to 1800s and such, and I'm glad to be on the podcast.
Yeah, you seem like a perfect fit for here. Also today, we're going to introduce our special guest, Caroline Schwartz. Caroline, would you like to introduce yourself?
Hi guys, I'm Caroline Schwartz. Not really a historian specialist, but I like learning, and I don't want to try being a surgeon when I'm older and out of these podcasts, so I'm here. Hi guys.
Yeah, so today we're going to be talking about the 1800 surgery. So I'm going to start with a little activity called What Do You Know About the 1800 surgery? So would you guys like to talk about some of your knowledge? I know, Abraham, you're a historian, so you know a lot, but just a little fun fact, or Caroline, we'd love to hear what you know as well.
Abraham, you can start.
Okay, so you have an 80% chance of dying
Oh,
from
wow.
surgery,
Okay.
so afterwards.
Way to kill the vibe, buddy.
I actually heard about that. So I think most people just assume that it's because of like the bad surgery practices, but really which is true, but really it's because of the infections that happen afterwards. So most people don't die there on the operating table. It usually happens once like a day or two passes and the infection starts to spread. So that'd be really careful. We're so fortunate today to have better technology that knows how to avoid these kind of situations.
Yeah, I can't. You killed the vibe. You like took the thunder. Like, I don't even know what to say to that.
It's gonna get worse. Just
I don't know. Wait, actually,
yeah, there's some pretty gruesome facts coming up.
all I know is that it was just really unclean, and that like doctors were like kind of crazy back then. Like they didn't there was like no hand washing station. Like it was literally like it was like grosser than like downtown LA, like the downtown LA.
That's saying a lot.
That's saying a lot. It's like it was gross. Like
Instead of washing their hands, they would just open it up so that the air would circulate instead, and they thought that would cure the system.
Wasn't it called like bad or like night air or something?
Yeah, it was called that.
That's weird. Think about it. Like, you're performing surgery, and your first idea when infections start is, oh, it must be bad air, instead of just washing your hands. That's crazy. Like, imagine how developed we are now.
Well, it really goes to show how different the time was back then. Like, today, we have all these medical practices that are a lot more advanced. But back then, they just didn't have the knowledge that we know today. And it sounds so easy to say, just advance your practices. But really, like, they just didn't know as much as we do. And they had to go through that so we can get to where we are today. So it's really quite impressive.
How were people living? Like, how were people surviving?
A lot of people weren't. There were some crazy death rates back then.
Oh my god.
The average life expectancy was 40 years old, so you'll be dead.
Are you kidding?
Wow.
I don't want to live past 20,
Some
but like 40 max?
Some people don't even have kids until then. That's like a big chunk
Okay,
of your
well, I
life
wouldn't go that
that's
far. I wouldn't go that far.
Some
40 without kids?
well, some people will wait a while in life, but that's a lot of milestone life accomplishments that you don't even get to have because you die so soon.
No, right? You don't even have a midlife crisis. Like, I'm already having one, but like that's different.
You don't have time for your first and second divorce.
You don't have time to fill into the keeping. You don't have time to start listening to Keeping Up the Kardashians. Like, you don't even feel any of that.
It just really goes to show how bad the practices were back then. There were some really nasty tools that they used during their surgery. Like, when we say it out loud, it just makes me visibly cringe. Like bone cutting forceps or bone saw, or even a bone file. They would file the bone off.
So like they would cut your bone off, like a little they would like trim your nails like a manicure.
Yeah.
And they file it down.
They would cut your bones like you would cut your nails. It's disgusting.
That's a manicure I am not paying for.
And they would speed run trying to cut off your limbs. Like the surgeons would brag that they could cut off your leg in 2 minutes and your arm in less than 30 seconds.
Think about the trauma that came from that.
So, we're going to get into a little ad break really quick. We'll be right back.
Recovery is a process everybody goes through, whether you're always abysmal or suffering from a traumatic event like surgery in the early 1800s. It's okay to get help, and ignoring your feelings doesn't get that, but BetterHelp will. With over 25,000 therapists online, find yours today, because patients in the 1800s didn't have that privilege.
Okay, jumping right back. So yeah, when we were talking about surgeries, there were some really nasty tools that they were using. For example, like when I got my tonsils removed last year, they used like a normal cauterization tool, which is very traditional. But back then, they didn't have that. They used full-on tonsil clampers.
Yeah, and on top of that, with like what Ibrahim said about how like, oh, they were like all like trying to compete with going fast and everything. Like some of those doctors would like not change their clothes. Like after surgery, after literally chopping off like limbs, they would keep that flesh and all that like that blood on them, and then they would go do their other. Like imagine your dentist comes in and they have like blood and flesh all over themselves, and they're like, oh, open your mouth, it's time for surgery. Like, hello?
Yeah, that's an immediate no. I would just,
and the people doing the surgery on your mouth are not surgeons, they're barbers instead.
Pardon?
Oh yeah, don't talk
Yeah,
about
the barbers were the ones pulling out your teeth, they were your hair nails and all that. And that's where the red and white barber thing comes from. The red represents the blood and the white the bandage.
What type of add-on is that, honey? Oh my god!
Well, back in that time, like surgeons weren't getting paid like they are today. They had a very low income, so most of them had to have day jobs. And for a lot of those people, it was barbers, and they were even using some of the same barber tools that they were inside their patients.
Isn't that the same reason why like most surgeons came from like really wealthy backgrounds? Because like they would go through all that like education, all that, and then they wouldn't even get paid.
Yeah, and on the topic of wealth, a lot of surgeons often use like poor test subjects as experiments.
I heard about that, and like didn't they like? But like at the same time, all that experimenting led us to like the improvements we have now, and like that's the same reason why like. It's like okay, it's like a more tame version, but you know like those like advertisements like, oh, try out this like a new drug, like this needle, like get like injected and you get paid like 1,500, you know? Yeah. And like that needle has like yeah, it's the same thing. It's just they don't like advertise the side effects. Like that those have like serious lifelong side effects. And you know who's gonna do all that? Like risk their lives for like 1,500?
The people who can't afford it.
People who are poor people that need that money. And it's just crazy, honestly. Like, I don't know. Like, personally, it just feels wrong to me, but at the same time, it's kind of what we need to do. You know? It's just what we need to do to grow.
Yeah, those people sacrifice themselves so we can have the technology advances that we have today. Like, it's so easy to criticize them and downfall what they did back then. But without that, we wouldn't be able to have the advanced technology practices and surgery practices that we have today if it weren't for all that trial and error.
Yeah, and also it's like nowadays these surgeries that we have is like normal, like oh you open your abdominal and like do a little surgery back there, close it up, or like tonsil, like how you said.
Yeah.
I personally never had surgery. I think my parents have surgery, and it's like I'm not like nothing like surprising. But then like back then surgery, like common surgeries were like amputations.
Yeah.
Like that was the common thing. Like oh you have a little like oh you have a cut there, oh it's infected. Boom. Like imagine you're walking perfectly fine. Next day you have no leg.
Oh, and during the surgery, they would make you drunk or give you opium or knock you out so that you don't.
They would literally knock me out. Like
no, because anesthesia wasn't invented until 1840, so you had to have some sort of like alcohol to try to lessen your pain tolerance or heighten your pain tolerance.
Yeah, and then gloves weren't invented until late 1800s. Like they were literally just shoving their bald hand inside your abdominal.
And they didn't wash it from the last patient.
That's what I'm saying.
Yeah, that's like nasty.
That's how infections were spreading back then.
No, yeah, and no, it's just sad. Like 80, like you said, 80% of the patients died, all because we weren't knowledgeable of infections. And but you know what's good is that that was early 1800s, right? But then at like 1846 was it? Yeah. It was right. 1846 was when like the first anesthesia was like discovered. Like you know, they did like ethan vapor, right?
Yeah, the vapor.
Yeah, can you explain what happened? I'm pretty sure it happened, but I might be wrong.
They'll just like give you vapor to your instead of like where your like your nostrils and mouth area, and so you would then go unconscious.
Yeah, and like that was like already an improvement. So honestly, it's really sad what happened in 1800s. But at the same time, it's like we improved. Like I feel like humans evolved really well.
And also, one thing I wanted to add was the female to male ratio for surgeons. There were a lot more male surgeons than there were female surgeons. It's because that males were not teaching women how to do that kind of work. And back then it was a different time period where women were at the house doing chores and housework for their children and their husbands. But the husbands were out there on the front lines doing the surgeries because they care about money, but not so much the patient's health.
But then at the same time, it's like they're not getting money.
Yeah, there would be barely any money. But that's still something for poor families, you know?
But then, it wasn't just, poor people weren't being surgeons. It was wealthy people because of all that money you waste and then you're not getting any. It was just wealthy people doing it. And then that's why women weren't like becoming surgeons because like none of these people that aren't getting paid want to teach a woman because back then they saw women as housewives. Like you said, like we didn't matter. We were,
the rich.
they literally saw us equally as bad as like the poor people they experimented on because back then they saw poor people like they saw them literally as experiments, like animal testing nowadays. That's what they saw the poor people back then.
Yeah, well, to conclude, it just sounds like it's a lot better now.
Yeah, I definitely agree.
Yeah.
I'm glad we've had these innovations, and I'm glad we've like moved on from all.
I'm sure glad we weren't born in the 1800s.
Yeah, exactly.
Girl, you're still in my joke now.
Anyways, guys, I just want to thank you guys for all coming back to another episode of Dissecting the Past. I hope to see you back for episode 34. We're going to have a really interesting topic next week with another special guest. So I hope to see you all then. And thank you for tuning in this week.
Thank you, guys. Bye.
Bye.